Hello everyone, this is Dr. Aksa Kamal. I hope that you all are doing great. Let us discuss about the topic that is latest and accelerating in the world of dentistry especially. Nowadays, doctors and scientists are working on rejuvenation of wound healing rather than only healing. And when it comes to the latest approaches, especially regarding safest intervention with optimum results, then only one thing comes in the mind, and that is platelet-rich plasma. What is platelet-rich plasma and how does it work? And what makes it so appealing when it comes to the safety? Let us start. In order to understand platelet-rich plasma, we must first know what are platelets. Well, platelets are tiny blood cells that help your body to form clots to stop bleeding. They're smaller than red blood cells and they're always present in the blood. They help you with the clotting. There are two main functions of platelets. Number one is the hemostasis that helps with the platelet plug and blood clot. And number two is the secretion of active protein that helps with the cellular chemotaxis, cellular proliferation, differentiation, angiogenesis, and regeneration. Now let's come to what is platelet-rich plasma. Well, now it's evident that platelet-rich plasma or PRP is an autologous plasma that is rich in platelet. There are two main types of platelet-rich plasma. Number one is the Buffy coat, which is the gel form. It's more denser, thicker, and it's used in the oral wounds. And number two is the plasma system, which is the injectable form. This one is more liquidy. Preparation of platelet-rich plasma is very interesting and it is very easy nowadays. Patient's blood is taken into a vacuum test tube and then it is placed in a special centrifuge machine. This centrifuge machine is specialized and it has specific preset revolution per minute. This centrifugation separates and divides the blood into three layers. Number one is the topmost platelet poor plasma layer. This middle thick part is the platelet rich plasma. It is mostly in the gel form. Especially in this case, this is denser and it is the gel form of platelet rich plasma. The bottom dark layer is the red blood cell layer. This gel form can easily be taken out from the test tube and it has to be detached from the bottom red blood cell layer in this way. Please note that the root of the platelet-rich plasma, which is the some amount of red blood cell, it must be remained attached to the platelet-rich plasma. It is because the small part of the root actually has so many essential growth factors that are very helpful in wound healing or other purposes. But when it comes to aesthetics, then of course we do not want any amount or part or any bit of the red blood cell layer in it. After detachment, the platelet-rich plasma can be easily inserted into the wound and it can be secured later on with the help of suture to avoid any dislodgement. Now, platelet-rich plasma has wide range of applications. It can be used in wound healing, it is used in orthopedic, sports medicine, rejuvenation, and many more. So how really does PRP work? PRP works first by clotting. Growth factors stimulate cells to repair and proliferate. The most important thing is growth factors. They play a very important and vital role in the healing of wound. These growth factors are present in the alpha granules of platelet, such as platelet-derived growth factor, PDGF, transforming growth factor, TGF, and many other growth factors. Investigations have shown that the healing process can be accelerated in the presence of these growth factors. How does all these growth factors work and really carry out the process? For that, we need to go a little deeper. Let us see how these growth factors actually work. Well, all these growth factors have specific function and specific role, and all of them work in their respective way to enhance the working of the cell. For example, transforming growth factor TGF. This is one of the growth factor which is present for sure in platelet-rich plasma. It enhances undifferentiated proliferation of mesenchymal cells. It also regulates the osteoblastic, endothelial, and fibroblastic mitogenesis. It also regulates collagen synthesis and secretion of collagenase. It regulates the growth factors, mitogenic effects, and inhibits macrophage lymphocyte proliferation. Thus, it also promotes endothelial chemotaxis and angiogenesis. Another growth factor that is present in platelet-rich plasma is fibroblast growth factor, or FGF. This growth factor promotes chondrocyte osteoblast growth and differentiation. It is also mitogenetic for mesenchymal cells, osteoblast, and chondrocyte. And of course, fibroblast growth factor promotes collagen, hyaluronic acid, and elastin. Platelet-derived growth factor. For mesenchymal cells and osteoblast, it is mitogenetic. For fibroblast, glial, or smooth muscle cells, it induces chemotaxis and mitogenesis. It regulates the secretion of collagenase and synthesis of collagen. It stimulates chemotaxis of macrophages as well as neutrophils. Epidermal growth factor, or EGF. This one is another growth factor present in platelet-rich plasma. It stimulates endothelial chemotaxis as well as angiogenesis. It also enhances epithelial or mesenchymal mitogenesis. It also regulates collagenase secretion. Vascular endothelial growth factor. This is a very, very important growth factor because it is directly associated with angiogenesis. Blood supply is the most important thing. Connective tissue growth factor, or CTGF, promotes regeneration of cartilage angiogenesis, fibrosis, as well as platelet adhesion. Insulin-like growth factor, or ILGF. It's a chemotactic for fibroblast and facilitates protein synthesis. It also promotes bone generation. Platelet factor. It enhances the initial inflow of neutrophils into wound chemoattractant fibroblasts. Interleukin. It is a pro-inflammatory mediator and inflammatory cell recruiter. Keratinocyte growth factor, or KGF. It enhances survival of angiogenesis. Up till now, almost every study on platelet-rich plasma, or PRP, has claimed that PRP enhances bone formation after tooth extraction, and also it has positive effect on bone regeneration. Many studies also claim that PRP is also very effective in the management of dry socket. Some studies also suggest that PRF, which is the platelet-rich fibrin, it can also expedite wound healing process. Well, those of you who don't know what is PRF, it is also a form of PRP, stiffer, tighter. It's like a fibrin sheet. We also have other benefits of PRP. Without any immunological rejection, autologous PRP is safe for use. Its preparation is conveniently learned and it is feasible to execute. But then again, there is some concern. During the processing stage, there is an infection risk involved because blood is involved. The procedure might be subject to some legal requirements in certain countries. Besides, some additional processing time is required in a busy practice and may impose some time limitation. But overall, it is concluded that adding PRP strengthens the weaker and compromised secondary clot. It is able to enhance cell adhesion and migration during the proliferative phase of healing. It gives you faster wound healing. It has minimal to no immunological reactions and, of course, no side effects. I would like to share some references as well for your better learning. I really hope that you liked this video and it helped you in some way. Thank you very much for watching. Bye-bye.